you mentioned that salt, because the increased salt intake is associated with the other goodies, which are the sugar and the vegetable seed oils and that combination, and that's where the deleterious effect. So when you get rid of that food, then of course blood pressure comes down, but we think it's allocated to the salt, but it's actually not salt. And I gotta tell you a little bit about salt. That
Please.
as a cardiologist, I was taught that salt is terrible. You got to stay away from salt, and everyone must be on a salt restriction, and you must only be on 2 grams sodium. Well, I tell you, I don't believe in the 2 gram sodium diet. In fact, my patients feel better when they're on a minimum 4 grams to 6 grams, and nobody measures it. But basically, I don't tell you to go measure your salt intake. No, I just say salt your salads, salt your foods. Don't go crazy. Don't eat processed food because they have all the salted stuff in them. So I don't restrict salt. The only patients that I restrict salt on are patients who have decompensated congestive heart failure. So obviously, if you're fluid overloaded, you have kidney failure, and your legs are swollen, and your lungs are full of water, then I stay away from salt. But otherwise, I don't restrict my salt on my patients. In fact, the studies do even show that if you do restrict the salt, you get more what we call neurohormonal activation, because you're really getting, the body is sensing that there's salt deprivation, so that it causes those neurohormonal changes that causes further vasoconstriction, and actually can worsen blood pressure. And the neurohormonal activation is not very healthy for you in multiple ways, not only just blood vessels, but your platelets and your reactivity, and we can talk about the angiotensin receptors as well, and how they all get affected. And it's a fascinating subject. So I don't restrict salt. But the restriction should be on the processed foods and those combinations.
That's where it's coming from in our diets anyway. If we pay attention to that and get all the